What up, fam? It's C, and this time I'm back with a different kind of video. If you like these series, if you like this video, I will start a series. So please let me know if you are interested in different things pertaining to women and women's health. I've always been fascinated with the body. And let me leave a disclosure, I am not a medical physician. So always, when we have these discussions, consult your physician first, okay? Now, I'm going to start off with how this all came about and why I decided to make the video. I was at a meeting today at work, and a young lady, we were just talking, just general talk. We work for the same company. Never met her before. I don't know her from Adam. And we were just talking, you know, about basic life things, marriage, you know, women issues. Very friendly. I'm very friendly too. And she, you know, I was talking about my son, my younger son, and something that he had done. And she asked me about my children. I told her that I had an 18-year-old and I did have an 8-year-old. So she disclosed to me that she was trying to become pregnant. Her and her husband had been trying for quite a while, and she's not been successful. So that's what brought up this topic. And I'll just give you a little back history on me. Prior to my husband, my older son is not my husband's child. That's his father because he raised him. And, you know, due to medical issues, his father is not very active in his life, but it's something that cannot be controlled. That'll be a whole nother video. And so pretty much my husband is who he knows as his dad. He knows it's his stepdad. He knows the situation. But anywho, when we were engaged, we were doing what typical couples do, handling the scandal. And I noticed that we weren't taking preventative measures for me not to become pregnant. He has a child from a previous relationship. I have a child from a previous relationship. We both knew that we wanted to have children. So I'll just say that. We were engaged, we were getting married really soon, the wedding had been planned, started planning, etc. And to me, I'm just like, wow, I would think that I would be pregnant. As much as we're having relations, it's kind of odd to me. So, got married. We were actively trying, making sure that it was during the time that I am the most fertile. And still nothing. Now, fortunately for me, it wasn't long before I was able to get pregnant, and I hadn't dealt with infertility issues in the past because I had a child already. And so I knew that I was capable of becoming pregnant. So I worked at a hospital, in the secretarial aspect of the medical field. And in working there, a lot of women used to come in for infertility. And, you know, one day I just asked the doctor, you know, you work closely with the physicians, you know, about this test that I kept hearing about. So that's what I wanted to share to you. If there's anyone suffering from infertility, there's a test that should be the first step. Once you make sure there's no STDs, I'm not trying to offend anybody, but sometimes you can be protecting, you can be monogamous. It doesn't necessarily mean that the man is being monogamous. So you should always be tested for STDs to make sure. There's no endometriosis, and there's PSOS. I'm not sure. There's another issue with a hardening of the uterus. I can't remember it offhand. So once you do all that, you need to go to your physician, call your physician, and let them know that you want to have a hysterosalpingogram. And I'll spell it out here. And I'll also leave all the link to all the information, pictures, etc. down below. So I ended up having a hysterosalpingogram. And a hysterosalpingogram is basically Roto-Rooter for your fallopian tubes. Liquid plumber for your fallopian tubes. Now, I'm going to set a little, don't make fun of my bootleg Dr. Oz demonstration. So this is a basic example. Normal fallopian tubes, these are straws, basically look like this. So they can go up and in. I know I'm all over the place. They go around and they're connected to the uterus. So They're straws, so they're not going to bend perfectly to the uterus, okay? Basically, women ovulate, we menstruate, and everything basically goes through the fallopian tubes. You can get blockage. It's kind of like, I'm going to be very graphic, so if you're kind of squirmy, this is not the video for you, but this is a very informative video. There can be blockage, basically, of the mucus, of the ovulation material, etc., etc. So when there's blockage, it basically looks like this. For clear purposes, I'm going to show you. Typically, this is the fallopian tube. This is the man's sperm or semen. It's too big. And it goes through the fallopian tube like so. But this is backwards because it goes, sperm of course travels upwards. So I'm just giving you a basic demonstration. It goes through and it travels. See how that goes through? And it travels through. And that's how the semen flows up the fallopian tubes in order to fertilize the egg. Now, there's blockage. Just making sure this is still filming. This is what you got. Basically, and it can be all throughout. I'm just trying to pinch it through. You have blockage in here. See that? So, you can drop the egg, the semen in, goes through the fallopian tube, and it's trapped. It's trapped and it dies. It's not able to make it through like it should fully be able to make it through in order to travel up to the egg and fertilize the woman's eggs. So the test is called a hysterosalpingogram. I had the test. Typically the test is done 2 to 5 days after your menstrual cycle. Okay? What they're basically going to do, and I'm just going to look up some information to give you a little more facts. What I had done was I had the test. I changed my clothes. I lay down on a table. It's done in usually a hospital, in like the radiology department, the same room basically that you would get an x-ray in. It's done in fluoroscopy or under fluoroscopy guidance is what they call it. The room looks just like a standardized x-ray table. What they're going to do is they're going to put a little teeny tube inside of you. Kind of like, I don't know if any woman has ever had a catheter placed. It's very tiny, like it's as small as this pin. It's a very teeny tube. And they put it in. When they first put it in, it will be uncomfortable. Typical of getting a pap smear. So it's kind of uncomfortable. You know it's there. You can feel it. But it's so tiny, it's not that painful. Kind of like a pinch when you get a needle. Once it's inserted, it's fine. Next thing they're going to do is they're going to give you a contrast or a dye, which is the layman's term for it. They're going to give you IV contrast. If you have an iodine allergy, you must let them know prior to having this test. It's a life or death situation. If you're allergic to anything, just shellfish, etc., iodine, be sure to let them know anything that you're allergic to when you're scheduling, because some people who are allergic to iodine or shellfish can have a reaction from IV contrast because it does have iodine in it. That's a disclosure. They're going to give you the injection, and what the injection basically is going to do, they give you an injection through the tube. So they're going to take a needle. Well, the tube, this is the tube. The tube is already placed inside you, like so. Then they're going to take a needle and put it in the tube, not in you, it's in the tube. And they're going to press it like you're getting an injection of something, and the dye is going to push up into the fallopian tube and clean out anything that may be blocking the fallopian tubes. It is a little painful. I would equate it to menstrual cramps. Just slight cramping, a tummy ache is very bearable. You're awake. You don't need to be put to sleep for the test. You are completely awake. the cramping, and you may start spotting after. So bring a sanitary napkin or some panty liners. It won't be heavy bleeding, but you may start spotting after. My doctor always jokes, because I work closely with her, that she got me pregnant. I got pregnant less than 2 weeks after I had that test. Now, they give you a time period. I don't remember exactly. They may give you a time period, or don't have unprotected sex for at least maybe a week. That's for example. I don't remember all the details. It was done a long time ago. It's not giving me that much information on the internet. Right when I was able to have sex unprotected or have relations, I got pregnant. It's like, I was a little down, because when I first had the test, she was like, you only have one fallopian tube. Shocked me, because you never know what's going on inside of our bodies. It's something I was born with. One fallopian tube. She said that's all it takes. And that's exactly all that it took. I got pregnant with my little guy. My tubes were cleaned out. I also got pregnant right after him, but I did miscarry. So whatever was going on was definitely handled. So that's why I say it's kind of like liquid plumber for your fallopian tubes. It just pushes all that mucus out. So I don't want anyone to be discouraged if they do not have 2 working fallopian tubes, because it only takes one, like she said. If you have any questions that I may have left out, please let me know. I'm just going to read some information. I will leave links down below. Sorry, I'm just looking in the iPad, to WebMD and other, the Mayo Clinic and other facilities that have information on this. It does say, before preparing for your hysterosalpingogram, tell your doctors if you have any pelvic infections or pelvic inflammatory disease, PID, any sexually transmitted diseases such as gonorrhea or chlamydia. If you're allergic to iodine, which is what I said, also tell your doctor if you have asthma or are allergic to any medications, or have had a serious anaphylaxis, which is basically a serious reaction to food or drugs, such as venom or bee sting or eating shellfish, which I knew just from working there for so long. If you have any bleeding problems or taking any blood thinners, let them know as well. History of kidney problems, diabetes. I'm going to leave the link. Like I said, I'm just going basically over. It's saying 2 to 5 days after your menstrual period is when you have the test. If you're a regular, consult your OBG. I know some women don't get their menstrual cycle, which like way back in the day, it wasn't normal for us to get menstrual cycles every month. I'm talking about like in the 1800s. Women did not have menstrual cycles every month. So if you get yours every 3 months, you will have to wait. And you call as soon as you start your first day of your menstrual cycle. You make sure you call that hospital. If you're unsure, you need to call around different hospitals, or you can do a Google search for hysterosalpingograms, and it will let you know in your area what hospitals perform. You can find out what hospitals perform, or any hospital with a radiology department. You can get the number to all the different hospitals and their radiology department. It's either done, you can call fluoroscopy or you can call ultrasound, because sometimes it's under ultrasound guidance. I won't get into the medical terminology, but you would just speak to someone in the radiology department. They'll be able to help you. It's called the hysterosalpingogram. All the information will be below. You might need to sign a consent form, just like if you've had a CAT scan. If you have had a CAT scan in the past and you are allergic to the IV contrast, make sure you let them know. So I really hope that this can help someone. This should be the first step that you should take prior to going to a fertility specialist or a fertility clinic and taking the injections, etc., etc. So this should be the first initial test that you take. And I hope this can help someone. If you know someone who is trying really hard to get pregnant, please let them know, because I know how hurtful that must be. And some women blame themselves, and it's really not your fault. And even if I didn't have my little guy, I was blessed with having a child already. And some women may or may not ever know what that is going to feel like. So if you know, if you meet women who are just talking to you, please spread the word, because it's kind of hurtful if you really want a child and you're unable to have one. If you have any questions, comments, Let me know. Please like, thumbs up, and share. Also, let me know if you would like to see a series on women's health issues. Like I said, this is a impromptu video. Thanks for watching, guys. Stay tuned for the birthday weekend lookbook, and I'll talk to you later. Bye.